I'm Dr. Pilar Bilbao, Head of Clinical Operations at CLINUVEL. Earlier, we announced a key milestone in our first ever clinical study of afamelanotide in stroke patients. The study CUV801 is primarily focused on the safety profile of afamelanotide in stroke patients. Each of the 6 adult patients who have been administered the drug after an ischemic stroke will be monitored for up to 42 days and subject to a range of assessments. But it is the safety that is of greatest interest at this stage in the program. In clinical research, we cannot take for granted that a drug safety profile will be consistent across patients with different disorders. So while a treatment may be well defined and understood for Group A, it may have a completely different effect on Group B. This potential is even greater when you're looking at groups of patients with vastly different conditions, such as chronic versus acute, or neurological versus metabolic, or patients with the same condition but different characteristics, such as in children or as opposed to adults. It means you need to focus on safety throughout a clinical program, but most intensively when starting with a new patient group, as we're doing with CUV801. There are a number of safety data points that we monitor in studies in order to monitor adverse reactions. Put simply, adverse reactions are any unwanted or undesirable effects which might be attributed to the interventional drug treatment. I say this may be attributable to treatment as we must err on the side of caution. If either the healthcare professionals responsible for the patient treatment or our own medical team believe that an effect reported during the study may plausibly be linked to treatment, it will be reported as an adverse reaction. It's comforting to our team that in this stage of CUV801 study, we have had no reports of adverse reactions. The study is ongoing, of course, and we will continue to monitor safety and efficacy endpoints until all patients complete the study. The next steps, and now that we have the 6 patients and recruitment has concluded, we are waiting for the last patients to finish the study fully. All the data are then collected and quality checked, and we will do a formal analysis and write up findings in a report. For today though, it is positive to know that our first study is fully enrolled and we will await results later in 2022.